Hi, I'm Dr. Behrooz Torkian. I'm a facial plastic surgeon at Lasky Clinic in Beverly Hills. We've been talking a lot about aging and how volume changes as we're aging. And we've seen volume in the cheek talked about. We've seen volume even in the bone talked about. Volume shifts over here. We lose a little fat in the pre-jowl area, and then the jowl area can hang out. Some volume shifts in the buccal area, and we're aware of that, sometimes more, sometimes less. The only way it can really be more is when it pooches out. And that's really similar to the under eye. But what is the one thing that is really aging you that you haven't even thought about? Well, I'll tell you, it has to do with your eyes. We know that the eyes are the window to the soul. And when we first notice changes around the eyes, the first thing we notice is the change right here in the tear trough area. We notice a little bit of volume loss on the bone over here. There's some fat there that's probably drooped down, and there's a little bit of fat that atrophies with age. In addition to that, even the bone can change and atrophy with age. So one of the very common treatments that we've used in the past that's now getting some controversy is to use fillers in this area to fill the area. Or as you get a little bit older and the covering of your fat that's inside of your eye socket gets a little softer, we can actually use the fat that is pooching out and causing bags to fill over this area. We can also even suck fat out from your belly or your thigh or from your back and put it in this area to build up the area. And those things have been really helpful in this aging look or that tired look around your lower eyes. But the one thing I'm thinking of now is the upper eyelid area. And we see a lot of hollowing or volume change in the upper eyelid, which people don't even notice is happening. A lot of times it makes the skin in the upper eyelid look a little bit more excessive than it actually is. Sometimes, as is in my case, you can see that the skin is retracting backwards. That retracted skin isn't necessarily bad depending on the position of your eyebrow, depending on the position of the bone with relation to your eye, and the strength of your actual eyelid opening. Those things may actually look okay, but in some cases where there is a hollowing in this area, there follows an A-frame deformity. And what ends up happening is that you get instead of a round and smooth contour around the eyelid with a little bit of skin hanging on the eyelid, approximately 3 or 4 millimeters above your lash line, you get a skin hanging a little bit higher, and you get a shadow above that skin, and then you get a shadow or a reflection right on the bone of the orbital rim. And that actually makes you look older, believe it or not. This is not something that all plastic surgeons or all aesthetic providers will recognize or feel comfortable treating, but it's a really important area around the eye that deserves attention. So one of the things that I like to do in my practice in order to treat this is to use filler. This is like the basic treatment in a young person who otherwise doesn't really need any kind of surgery and doesn't really have much excess of skin. I'll take a little bit of Restylane, which is generally softened or watered down with a little bit of injectable saline. That is injected with a cannula, which is a blunt-ended needle, meaning it doesn't have a sharp end to it, that enters right next to the eyebrow here and right about the tail of the eyebrow there. And that filling effect allows for a fuller and more youthful looking eyelid, just like you used to have when you had some fat around the eyelid. The other thing that I really like is I've been using some nano fat or microfat. And what that is basically is when I'm doing another procedure, say I'm putting fat under the eye or putting fat in the mid-face in this area in order to replace fat volume that has been depleted with age, or if I need to use fat to replace any kind of collagen, meaning using the nanofat, which has stem cells in it to replace collagen in a certain area, such as the skin underneath the eye, which can sometimes have a purplish color because it's so thin that it lets the muscle color show through. Then I'll use some of that fat in the upper eyelid area. It goes right along the bone. It's right in here, right where my finger is there. And what it does is fill up that area just like the filler does, and it gives you a nice full appearance just like you used to have when you were younger. And then another thing that I like to do is when someone has a little bit of excess skin, say they're in their mid-30s or if they're in their mid-40s or early 40s, and they're starting to realize that they have a little bit of excess skin, that excess skin, when it's removed without removing muscle, this is really important, then it allows the muscle in some cases to roll up a little bit. So you're creating a smaller envelope or a smaller container for the muscle, and when it comes back together and you pull the skin together, it fills up the volume right in that area. That's a nice little trick, and over the past several years, we've noticed and seen that most people's eyelid procedures, most surgeons' eyelid procedures, are preserving the muscle and preserving the fat, and this is one of the ways to do it. And then another trick that I've found really helpful more recently is a transposition of fat from the upper eyelid onto the hollow area. And the way that that works, you notice sometimes you can look at an older person's eye and you notice a little bulge of fat right there in the medial portion of the eye. Sometimes during a blepharoplasty procedure, we'll make a little hole in orbital septum, which is like a little covering that keeps the fat of the eye socket in place. And we'll take a little bit of that fat out, generally the size of a small pea, and it's cut out without any consequences or problems. And it generally releases or kind of causes a flattening in that area and a proper shadow that follows the eyelid, normal eyelid shape. But one of the things that does happen with that is that it contributes a little bit more to the hollowing. So instead of getting rid of that fat, just like we don't get rid of fat in this area in some cases when we have hollowing, we use that fat, we transpose it, and we put it on the tear trough area and stitch it in place as if it was a filler or a fat graft that came from your belly. We can do the same thing here. So we take that fat, move it up, and stitch it onto the bone or onto the coverings of the bone. And that gives it a nice, fluffy, fuller appearance that makes the eyelid look younger. And at the same time, through that incision, we're removing a little bit of skin and rolling up the excessive muscle that's there. So the concept of being able to save that fat is really essential, and it restores the shape and contour of the eyelid in order to remove what we call the A-frame deformity that can make you look younger. So that's one of the things that I think people are missing in doing their eyelid corrective procedures or their eyelid rejuvenating procedures. A lot of times you may see some celebrities that have had eyelid changes that have been really obvious or noticeable. I won't name names, but some of them used to have very full eyelids, and then they get an upper blepharoplasty because they get extra skin because they're in their mid-40s or something. And in the process of removing their skin, there's fat removed, there's muscle removed, and then it creates a harsher crease than they used to have in their eyelid. And then they just look different. Doesn't necessarily look bad. Some of the work is brilliant and beautiful. But because that's a recognized celebrity and had a certain look and they look different, it just doesn't look right. And then it kind of falls out of favor of the public eye. So one of the things I think you should always pay attention to, and ask your surgeon, ask your doctor, what about the volume in my upper eyelid? If you have any questions about this, please don't hesitate to call me or call our office for a consultation. And of course, down in the comments area, any questions that you have, any guidance that I can give, I'm happy to help.